after sneezing and also for coughing, the pain is becoming worse every day, maybe 3 or 4 days later, and I feel that this is not okay. So I immediately call my general physician and take an appointment to him, and he asked me to go for immediate MRI. And I just finish my MRI, take the report to the neurosurgeon, and he says that okay, this is the time you need to go for surgery immediately. Either I can maybe go for like a regular surgery, or maybe a minimal invasive surgery, or maybe other one. So, but the thing is that at that moment, my country only have two kinds of surgery. One is the old type traditional, and the other one is like invasive minimal surgery. While I sneeze, at that very moment, maybe 1 minute or 2 minutes, I just black out for 2 minutes. It's like I can't see anything, I can't think anything. The thing is that my regular activities, even my office work, my family life, everything hampered. I can't concentrate a single moment for other things. I just concentrate on myself, what will I do next, and how can I stop my sneezing or coughing. So after 2 days later, I feel marvelous and I feel miracle in my life. After like 9 years of pain, and also for last 4 months of significant pain, I feel like 90% everything is okay. Actually pain is gone. Only thing is that I feel little stretched, which I should go for some exercise, which will take maybe 3 to 4 months time. But the thing is that my regular life activity is done. I can walk, I can I can go for nearby coffee shop also, and I take my coffee, and okay, I think that what I can do tomorrow. Hi, I am Rajibul Hasan. I come from Dhaka, Bangladesh, and recently I have a surgery for L5S1 disc prolapse, this herniation. So now I am recovering. Just 2 days ago, which just happened, and I'm feeling far better than expected also as before. This back pain, which has started around 2013, one day I'm going to office, suddenly I need to fix my shoes, and in that moment it started suddenly, and I can't go to office in that day, and even for next 7 days even I can't move to the toilet also. I need someone assistant to go to the toilet, and after that I go for a neurosurgeon, and he took me the MRI, and the report says that my L5S1 disc have some issues, so I should take some days sleep and some rest, and I maybe go to the physiotherapist for some physiotherapist activities. But if that is okay for me, then okay. If that is not okay, then I need to come for better medication or maybe for surgery. But after 1 month, after maybe 20 days, the back pain gone, everything gone. So I feel almost relief. In next year, 2014, it's in the winter time, I went to one conference in Shenzhen, China, and in that very moment where I'm just making myself ready for the conference, suddenly my back pain started. And I can't move even to the toilet. So I called my colleague that take me immediately to one Chinese traditional clinic, and they asked me, okay, we need to go for a digital X-ray, and they do the digital X-ray at that very moment, and they told me that okay, just lay down in the bed, and they just give me some hot oil and press one single point. At that moment I just shouted because it was of pain, but the pain gone immediately, and I was so feel okay. But in the moment that Chinese traditional doctor says that no, don't laugh or don't be happy, because it's gone for only one time, and with the digital X-ray we found that your disc prolapse and this herniation is so bad that you need to go for surgery one day. The next year I went for, actually that moment it's gone for within 1 day. So I feel relief. But in 2015 I went for again for a conference. I went to the Hong Kong, and also suddenly same thing happened. So this time I went to general surgery ward. They took the MRI. They took me to the MRI and they confirmed me that my L5S1 disc prolapse is so significant that I must go for surgery either today or maybe some days later. Then I asked my doctor, when should I go for surgery? He said that actually you have back pain, maybe within 15 to 10 days later the back pain will come with some painkiller, actually, especially for Voltaren or some suppository or maybe injection. But the thing is that one day you need to come for surgery. I don't know when is the day, sir. The doctor said that I will not say, you will say, because you are only 27, so you will come and you will say that I need that surgery. And then, sir, when maybe after 10 years or 20 years, then he said that no, actually this back pain lead you to the leg pain one day. Maybe it will be worst or maybe something like that. So I feel it's okay. I don't have leg pain, I don't have so much pain, and then that moment I just returned back. And it's again come after 2 years later in 2018 in the winter. Actually all the back pain related to the timeline, I see that it comes in the winter especially. It's like November or December, but it goes always in January or February when the weather is becoming okay, or maybe it's like this way. But in 2018 what happens, in that time I feel little awkward for moving forward. And what I see in the MRI when I go to the doctor, I went to the Chennai CMC doctor, and he says that yeah, you can see that from all the MRI report from 2013 to 2018, every year the changes is happen, like my nerve is going to be blocked one by one, and I can't lift up my leg. Like right leg is, it's okay, I can go for 90 degrees, but for left leg I can maximum goes for 50 degrees or 40 degrees in that moment. I said that when I can go for surgery. He says that okay, you can wait for the leg pain or maybe worse situation. So I wait for that moment, and it happens in 2022 in the March, last 4 months ago. I don't remember the exact day because it's a regular day, but suddenly my leg pain started. I thought that maybe I was walking last night so much, so that's why I just go, okay, take some paracetamol, painkiller, general thing. And while the leg pain is not not okay for 2 days later, and after sneezing and also for coughing, the pain is becoming worse every day, maybe 3 or 4 days later, and I feel that this is not okay. So I immediately called my general physician and take an appointment to him, and he asked me to go for immediate MRI. And I just finish my MRI, take the report to the neurosurgeon, and he says that okay, this is the time you need to go for surgery immediately. Either I can maybe go for like a regular surgery or maybe a minimal invasive surgery or maybe other one. So, but the thing is that at that moment my country only have two kinds of surgery. One is the old type traditional, and the other one is like invasive minimal surgery. But when I sees that my pain is becoming worse every day, then I finalize my surgery on May 28. Okay, and at the moment I just prepared everything. But the thing is that my pain is becoming more every day, and while I sneeze, at that very moment, maybe 1 minute or 2 minutes, I just black out for 2 minutes. It's like I can't see anything, I can't think anything. The thing is that my regular activities, even my office work, my family life, everything hampered. I can't concentrate a single moment for other things. I just concentrate on myself, what will I do next, and how can I stop my sneezing or coughing. So I take medication for 2 times for Montelukast, and also take fexofenadine, also take levocetirizine. I am taking all things so that I need to stop my sneezing in this way. This is not the way, but and also taking Voltaren and also taking 2 painkillers also. And I talked to the doctor, and doctor said that I should immediately go for surgery, and but while I heard that the surgery, which is just regular or minimally microdiscectomy, which recovery rate is like 90% or 80 to 90%. But the thing is that for recovery time, it's like I need to go for 3 to 6 months, very conscious life, and I need to go for very careful life living in that very moment, because that 6 months I will feel the pain. If I even walk, even if I go for driving, even small speed breaker will give me little bit pain. Not little bit, they said that it will be a significant pain. So you need to be habituated with that pain, because that moment you cannot stop it. So, and another thing is that I cannot go back to my regular life like next 6 months or 1 year maybe, because I can't take my child in my lap, or I cannot take my even backpack in my back also. So I asked them, what is the alternative solution? They said me that actually in general surgery, disectomy or maybe microdiscectomy, whatever do this world like third world or second world, it's a like regular practice like this way. But if I can go for like robotic surgery or other things which is very much available in Singapore or maybe Thailand or maybe Europe and America, they do the advanced one like endoscopic spine surgery. That is, they have earlier recovery and they have many flexibility after the surgery. I said, okay, I can't wait anymore, so I will go for surgery. But at that moment my neurosurgeon was so busy, so my surgery was rescheduled to 1 week later. And one day while I go outside and I got cold, so sneezing started, and I just feel every hour, every minute I'm just crying. At that moment I just searching the advanced way how to stop sneezing, other things. Then I found a newer way of new technique in my YouTube, and found that endoscopic spine surgery is much more advanced. Maybe in 2017 or 18 it introduced all over the world, and even India have it. India is my neighboring country, so it's very much easier for me to travel around, and I can easily talk to doctor with the local language. So I just trying to find out which one will be better. So I contact Chennai Apollo, also Delhi Apollo. I consult with that surgeon also there, and also in that moment I check the price also is very much good price compared to Bangkok and Thailand. And they ensure one thing is that after the surgery I can be recovered within 1 day or 2 days. Then it's a like miracle to me, because in general surgery or maybe microdiscectomy I need to lay down in the bed for 14 days, but in that cases I need to lay down only maybe 3 hours or 6 hours like this way. So while searching again and again, so then I find out my miracle doctor, Dr. Devashish Sharma, and I just immediately tried to contact with him, and I got feedback from his assistant, and he told me, okay, I should send all the reports, especially for MRI report and CT scan if I have, then I should send it immediately to him, because they need to ensure that either endoscopic surgery is possible for me for my cases also. So I send immediately, and I got a feedback within 2 days, and I got an appointment and go for video telephony. And doctor ensures me that in my cases L5S1 disherniation, it can be possibly to remove, and by 100% actually success rate is okay, but these cases easily can be done in these cases. So I just think I don't think twice, so I just ask him the costing, if the costing is within my range, so I immediately make my appointment for the surgery, make preparation for this surgery, and within 1 month I just come here. And before surgery I want to let you know one thing is that while my surgery is going to happen, in that moment I was so frustrated, I was so out of mind. So I think that maybe it will be never okay in my life, maybe I am lost in my whole life. That's why I asked my doctor, what can I do, because I am just feeling that pain, and the pain is severing every day, becoming worse. So he asked me I should go for single nerve root block for temporary cases like 1 month or 2 months. And I went to my doctor in locally, and I made my S1 nerve block for temporary, and it gives me like 50% relief at that moment. And after the single block, I feel little bit awkward, but the thing is that the pain gone like 50% or 70% like this. But I can move on actually. Then I can think straight, okay, I will go for surgery, and I come for surgery. And before the surgery I was actually a little bit frustrated also. Either is it possible to move on after the surgery? How is that possible? Because this is a big surgery. Everyone in my country and everyone in also China, also Hong Kong and other countries said that I should go for taking rest at least 14 days in the bed, and I need to stay at least 7 days nearby hospital. So how it possible I can relieve in the next day? Actually, even at the moment I don't believe even I come here. But in the morning I go for OT, and surgery happened. I woke up at the 2 p.m. and I'm asking that, is the surgery is done? Yeah, this is done. So I just feeling my leg also in that moment. I said my leg is okay, I can feel that. Okay, I'm feeling so happy in that moment that I feel my leg, I feel my everything, and there is no pain at the moment. I think maybe it's for painkiller. So I'm not overwhelmed. I'm just waiting. Okay, when can I walk? So I'm waiting at that moment, and after the doctor come in the same day in the evening, and he asked me to walk on and move forward. I was astonished. How can I move on? He said, okay, you can do it. And I can do it. And in that moment I see that, yeah, my surgery is okay, my surgery is done, and